What you need to remember is unilateral upper lobe bronchiectasis, the answer is tuberculosis. Bilateral upper lobe bronchiectasis, the answer is cystic fibrosis. Cystic fibrosis and ABPA are the two most common causes of bilateral upper lobe, and I've written down, whatever is there, and when we send it to you, you can read it in detail. This is an old one which has been repeated, but it's part of the same process. Therefore, bronchiectasis sicca. D. How many for D? I must check it. I must go back and check the answer again. What if Sjogren's syndrome was in the options? Okay. The answer is A. Tuberculosis. I very clearly mentioned in a lot of books, not in probably the mainline books, but I've looked at least 5 or 6 books. Most of the books would mention tuberculosis as the answer. I tried to, this option did not have Sjogren's syndrome in, but I tried to look at Sjogren's syndrome itself. They do mention that you may get Sicca syndrome, but in terms of bronchiectasis, Sicca, the terminology has only been used with tuberculosis. Brock's syndrome. Anybody? B, correct. So Brock syndrome is middle lobe bronchiectasis. And these have been asked multiple number of times. What is HBH? What is HB Bart's? Alpha thalassemia trait or alpha thalassemia silent carrier. It has also been asked how many genes code. So there are a lot of questions that come from this, and this is an easy one. This should not go wrong by any one of you. This is what we've done. Okay, what about this one? I haven't put the answer on this one. How many for A? How many for something else? So the answer is A. It's extremely important to remember that although Wilson's disease is a copper overload syndrome, and all of us know it and all of us remember it, when and how much soever we have the concept in our mind, when we go and when we sit for the exam on the day of the exam, we get confused. If it's an overload syndrome, why would serum copper not be increased? But the fact is that total serum copper is not increased in Wilson's disease. It is only free serum copper that is increased in Wilson's disease. Heavy chain disease with kappa light chains in urine. So what is a heavy chain disease? A heavy chain disease is, the answer is A. And the questions that have been asked are essentially the same. So out of heavy chains, what is asked is what is Franklin's disease? The answer is gamma chain. Which is the most common heavy chain disease? The answer is Seligman's. And the third question on mu chain which is asked is the same. May produce monoclonal light chains typically of the kappa type. So one for each, and these are how these questions are asked. Not a very important topic, but one question from each one is most frequently asked. This should be easy. A. Correct. A. Absolutely correct. But all the tests are for any test which is not done for PNH. And now the CDK and 1B. So menin gene is men1, RET genes are for men2, FMTC is what stands for? It has been included in men2. So therefore I have kept it outside for the moment, but if it includes, it has to be, if it has to go in one group, it goes into men2. And I think in the new classification in Harrison's that they have used this time in the 19th edition, they have classified it as a subset of men. I don't think this will come, but it has been asked and therefore I have put it. Answer is? Excellent. This side, everybody studies a lot, I guess. Okay, so once I send you the explanation, you'll have it in detail, but it's essentially about ACTH resistant adrenal insufficiency and not Cushing's, which is excess. There was a question that was asked which was about tufting of terminal interphalangeal or terminal phalanx. Tufting of terminal phalanx is seen in. And the reason I have put this is because even in the book that I had written on medicine, I had the answer wrong. Acromegaly. So it's subperiosteal resorption. That would be hyperparathyroidism. For if the question talks about spade-like terminal tufts or tufting of terminal phalanges or arrowhead deformity, the answer is acromegaly. Hung up ankle jerk. How many for A? Everybody else should have put A, because everybody I would understand would know that in hypothyroidism the reflexes would be sluggish. So it's probably just another name.